The Department of State Health Services says Texas is on track to receive almost 2 million more COVID-19 vaccine doses next week. So far, 5 million Texans are fully vaccinated. But as KXAN's Maggie Glynn reports, doctors are still treating plenty of sick patients.
There was a surge of COVID patients there, and it had exceeded the capacity of the ICUs.
Florida-based Dr. Fernanda Jara came to El Paso in December to help frontline workers when COVID-19 cases overwhelmed hospitals. Since then, the ER doctor has returned to Texas each month, helping in the panhandle town of Muleshoe as well.
You know, a place like that that's so small, they just don't have the capacity to be able to manage COVID patients that are, especially the sick ones that require the ICU setting.
Doctors like him were needed here in Texas when we were facing surges and hospitals were strained. But this was his last trip to Texas as COVID trends are heading in the right direction.
Fatalities have been on a downward trend. We continue to see good progress.
Hospitalizations are at a 9-month low, and more than 13 million Texans have at least one dose of the vaccine. But
it's too early for us to really be excited about a lot of things.
The state is seeing vaccine demand start to plateau as supply increases.
We are wanting to do more and more messaging around vaccine hesitancy all across the state in order to help make sure that everyone is educated about the safety of the vaccine.
Meanwhile, healthcare workers urge us all to do our part to help.
You know, safeguarding the people that are vulnerable and making sure that they, or that we do collectively our best to sort of protect them from exposure and infection.
Maggie Glynn, KXAN News.
The state adds that Texas could start seeing the new Novavax and AstraZeneca vaccines by the end of April or beginning of May, pending FDA emergency authorization. There have been more than 2.4 million confirmed cases of COVID-19 in Texas. The state's dashboard shows that there are more than 3,000 new confirmed infections and almost 100 new deaths from COVID-19. In Travis County, there are almost 1,000 active infections. 140 people are hospitalized, 51 people are in ICUs, and 24 are on ventilators. Right now, some health experts are confused by a decline in COVID-19 infections in southern states. New infections are down in Texas and other states that have reopened businesses and eliminated mask mandates, while cases are increasing in places with some of the strictest measures in place, like Michigan, Pennsylvania, and New England. But health experts do have a few theories. One is the difference in testing rates. Alabama has experienced one of the biggest dips in reported infections, more than 50% in 2 weeks. But the state's also dead last in the U.S. for COVID testing, with only 56 tests per 100,000 people. Another theory, COVID fatigue. States where people are just coming out of lockdown for the first time in months are seeing cases increase, while many states in the South have been open in some capacity for months.
A lot of individuals in the southern part of the U.S., and especially here in Texas, have already been exposed to the coronavirus. So many individuals already have coronavirus antibodies.
The third theory health officials have is that more young people are acting as carriers. Doctors say they're traveling and returning to their home states, taking the virus with them. The bottom line, health experts say the decline in the South might be giving a false sense of security.